Listen closely because what I'm about to tell you will shock you and should make every single American furious. The Trump administration has just unveiled a plan that is not only reckless, but downright insulting to one of the most essential professions in this country, nursing. Yes, you heard me right. The very people who have battled on the front lines during pandemics, who have risked their lives day after day, who have provided care, comfort, and hope to millions, are now being told by those in power that their education, their sacrifices, and their professionalism do not count. Nursing is at the heart of our healthcare system, and yet someone in a position of authority has decided that nurses do not deserve to have their degrees recognized as professional degrees. This is not just a bureaucratic decision. This is a statement about how little respect is being shown to a field that literally keeps this nation alive. And make no mistake, this is causing outrage across the country. Nurses have always been the backbone of healthcare. From administering critical medications to monitoring patients under intense conditions, their work is complex, demanding, and indispensable. A registered nurse spends years studying anatomy, physiology, pharmacology, and patient care. They endure countless hours of practical training, clinical rotations, and licensing exams to ensure they are competent and ready to handle emergencies that can decide life or death. To suggest that all of this does not qualify as a professional degree is an insult so deep it cannot be overstated. It undermines decades of progress in nursing education. It diminishes the value of advanced degrees, and it sends a clear signal that the sacrifices of millions of nurses are invisible to those in power. The rationale provided by the administration attempts to frame nursing as more technical or vocational rather than academic, as if the rigorous study, the long hours of patient care, and the critical decision-making involved are somehow less valuable than other professions deemed professional. Let's get one thing straight. The argument is flawed on every level. Nursing requires analytical thinking, critical reasoning, and a level of empathy and emotional intelligence that no standardized test can measure. Nurses operate in life and death situations daily. They make split-second decisions that can save or end lives, and they coordinate with doctors, pharmacists, therapists, and families to ensure the best possible outcomes for patients. To classify this as anything less than a professional degree is absurd. The immediate reaction from the public, nursing associations, healthcare professionals, and even students has been explosive. Social media is flooded with messages of outrage, protests are being organized, and petitions are circulating demanding that this plan be scrapped immediately. Organizations representing nurses have denounced the policy as disrespectful, dangerous, and potentially harmful to the healthcare system. The concern is real. If nursing loses recognition as a professional degree, it could affect funding for educational programs, limit student access to financial aid, and even diminish career advancement opportunities. Hospitals, clinics, and the healthcare industry at large rely on qualified nurses. Undermining their professional status is not just an attack on the individuals, it is an attack on public health itself. Let's not sugarcoat the stakes here. We are talking about a decision that could ripple across the healthcare system, affecting patient care, the availability of trained professionals, and the morale of those who have dedicated their lives to saving others. Every nurse, whether they work in a rural clinic or a major metropolitan hospital, now faces the possibility of their degree being devalued. And make no mistake, this is a political move as much as it is a policy decision. The administration may argue that this is a technical reclassification, but the underlying message is loud and clear. The labor, skill, and expertise of nurses are not being properly valued. Consider the personal impact on nurses and students currently in training. Imagine spending years studying intensely, sacrificing social life, financial stability, and mental health, only to be told that your hard-earned degree is no longer recognized as professional. Think about the moral blow to people who have committed their lives to helping others. This is more than disrespect. It's a threat to the career trajectory and financial stability of countless individuals. Nursing students are asking themselves if the future they envisioned, the sacrifices they made, and the work they put in are even worth it under this policy. The answer should be a resounding yes. But this administration is forcing a narrative that says otherwise. The backlash has not been limited to individual nurses. Hospitals, universities, and professional organizations have all issued statements condemning the plan. They emphasize that nursing is a field that requires specialized knowledge, advanced clinical training, and continuous education. Removing its recognition as a professional degree undermines all of that, potentially discouraging future generations from entering the field. This is particularly dangerous at a time when the United States faces a nursing shortage. Hospitals already struggle to fill positions, and the pandemic has only intensified the demand for skilled nurses. By devaluing the degree, the administration risks exacerbating an already critical shortage, which could lead to decreased patient care quality, overworked staff, and increased errors in hospitals nationwide. But let's be clear, this is not just an issue of education. This is a societal problem. Nurses are at the front lines of crises, whether pandemics, natural disasters, or daily emergencies. They are educators, advocates, and caregivers. Stripping the professional status of their degrees is equivalent to sending a message that their contributions are not valued, and this message will have consequences. When a society fails to recognize and properly reward its caregivers, it risks eroding the very foundation of its healthcare system. It risks driving talented, dedicated individuals away from the profession, leaving critical gaps where lives are at stake. The policy also raises questions about political motivations. Is this a cost-cutting measure? An attempt to reclassify education for administrative convenience? Or is it a deliberate devaluation of a workforce that is overwhelmingly female, often underpaid, and historically undervalued? Whatever the reasoning, the effect is the same. Nurses are being diminished, their expertise called into question, and their role in society threatened. The outrage is justified because the policy is not just administrative, it is personal, professional, and ethical. Experts in healthcare and education have already weighed in, emphasizing that nursing degrees require extensive knowledge and skill comparable to, if not exceeding, other professional degrees. They warn that failure to recognize nursing as a professional degree could have long-term effects on healthcare quality, education standards, and public health outcomes. Universities offering nursing programs may see decreased enrollment, funding cuts, and difficulty attracting qualified instructors. This would not only impact students, but also the millions of patients who rely on competent, well-trained nurses every day. Public opinion has been fierce. Thousands of Americans have taken to social media, sharing stories of nurses who have gone above and beyond, risking their lives during crises to save others. Petitions are gaining momentum, calling on policymakers to reverse the decision and maintain the professional status of nursing degrees. The argument from the public is clear. Nurses are not just technical workers, they are professionals who deserve recognition, respect, and support. We also have to consider the global perspective. Nursing is universally recognized as a professional field worldwide. Countries that invest in nursing education see improved patient outcomes, reduced mortality rates, and stronger healthcare systems. By downgrading nursing education domestically, the United States risks falling behind internationally. It sends a message that the nation does not prioritize healthcare as it should, potentially influencing global standards, international collaborations, and the overall reputation of the U.S. medical system. The consequences extend beyond recognition and funding. Legal, ethical, and employment implications could emerge. Nurses may face challenges in licensing, credentialing, and professional mobility. Hospitals may struggle to maintain staffing levels, leading to burnout among remaining staff and compromised patient care. Communities, particularly those in underserved areas, could suffer disproportionately, losing access to qualified nurses and safe, reliable health care. At its core, this policy is an affront to logic, ethics, and decency. It disregards the expertise, effort, and essential contributions of a workforce that sustains the health of millions. It is met with resistance not because people are against reform, but because it is a blatant misclassification that undermines the very profession it targets. The voices of nurses, educators, hospitals, students, and the public are united in opposition because the stakes are too high to ignore. And let's not forget the psychological impact. Nurses work in high-stress environments, often facing trauma, illness, and emotional strain. They enter the profession to make a difference, to save lives, to help people when they are at their most vulnerable. Being told that their professional degree is no longer recognized is demoralizing. It risks driving talented and compassionate individuals away from nursing entirely, just when their expertise is needed the most. The human cost of this policy could be staggering. In conclusion, the Trump administration's plan to exclude nursing from professional degrees is an unprecedented challenge to a profession that forms the backbone of healthcare. It undermines education, diminishes professional recognition, threatens public health, and insults the countless nurses who have dedicated their lives to saving others. Outrage is not only justified, it is necessary. The voices of nurses, educators, and the public must be heard, and policymakers must reconsider the far-reaching implications of this misguided plan. Nursing is not just a job. It is a profession, a calling, and a cornerstone of society. Attempting to erase that recognition is not just a political decision, it is an attack on the very essence of care and humanity in America. Let's get real and put some numbers on the table because facts don't lie. According to the American Association of Colleges of Nursing, there are over 4 million registered nurses in the United States. That's right, over 4 million people who have invested years of their lives, poured thousands of dollars into their education, and endured intense training and licensure requirements just to serve the public. If their degrees are no longer recognized as professional, we are not just talking about a minor bureaucratic tweak. We're talking about undermining a workforce of millions. And the impact is immediate. Hospitals already struggling with staffing shortages could see even more gaps. Rural communities could lose vital care providers, and patients could face longer wait times, diminished attention, and a higher likelihood of medical errors. During the COVID-19 pandemic, nurses were on the front lines when hospitals were overflowing, resources were scarce, and doctors were stretched thin. Nurses worked 16 to 20-hour shifts, often without adequate protective equipment, and literally risked their lives for their patients. This is not some theoretical exercise in healthcare. These are real human beings performing real-life miracles, and yet, a policy like this would suggest their education and professional status are somehow less worthy. That is not just insulting, it's dangerous. It sets a precedent that the work of nurses can be dismissed, their professional expertise undervalued, and their sacrifices erased from the narrative of what it means to be a healthcare professional in this country. Let's talk about education itself. Nursing degrees are rigorous. A Bachelor of Science in Nursing typically requires 120 to 140 credit hours, combining classroom learning, laboratory practice, and clinical rotations. Students learn to interpret complex medical information, administer life-saving medications, respond to emergencies, and manage patient care plans. Advanced nursing programs, such as master's or doctorate degrees in nursing, involve research, leadership, and policy-making responsibilities. These degrees produce nurse practitioners, educators, and leaders in healthcare. By stripping nursing of professional recognition, the administration effectively says, all of this learning, all of this dedication, all of this skill is less than what other professions achieve. It's an outright attack on the value of knowledge, expertise, and training in one of the most essential sectors of our society. The public is not staying silent. Petitions opposing this policy have already gathered hundreds of thousands of signatures. Social media is ablaze with messages of support for nurses, from simple hashtags like #NursesDeserveRespect to long, heartfelt stories of nurses who went above and beyond during crises. One nurse shared her story about working in a COVID ICU, describing the emotional toll of watching patients struggle to breathe while families were kept out due to hospital restrictions. She risked exposure daily, yet the administration would have her degree downgraded in value. Another story highlighted a rural nurse who drives over an hour to care for patients in underserved communities. These are not exceptions, they are examples of the countless nurses whose work sustains the healthcare system. Let's also look at the financial impact. Nursing students often graduate with substantial debt, just like other professional students. According to the National Student Clearinghouse Research Center, the average student loan debt for nursing graduates can range from $30,000 to $50,000 or more. If their degrees are no longer classified as professional, it could affect eligibility for federal loan forgiveness programs, reduce scholarships and grants, and limit funding for graduate education. This is not hypothetical, it's a direct financial hit to those dedicating their lives to public service. Globally, nursing is recognized as a professional degree in nearly every developed nation. Countries like Canada, the United Kingdom, Germany, and Australia require rigorous education, clinical practice, and licensure for nurses, acknowledging their expertise as equal to other professional fields. The United States has long been a leader in healthcare innovation and professional standards, but a policy like this threatens to weaken that standing. It sends a message internationally that the U.S. may undervalue its healthcare professionals, which could have long-term effects on global collaborations, the recruitment of international nurses, and the overall reputation of American healthcare education. We cannot ignore the ethical dimension. Nursing is inherently a moral profession. Nurses make critical decisions, advocate for vulnerable patients, and often confront situations where life and death hang in the balance. By declassifying their degree, the government is sending a message that ethical responsibility, courage, and human care are less valuable than administrative convenience or political posturing. This is not just an educational issue, it is a moral one. Consider the long-term societal consequences. A country that does not value its caregivers risks severe consequences. Fewer students may choose nursing as a career, leading to more shortages. Experienced nurses may leave the profession, disheartened by the lack of recognition. Patient care could suffer as hospitals are forced to operate with fewer trained staff. Rural hospitals, already struggling to retain nurses, could face closures or severe service limitations. Urban hospitals could see increased turnover, burnout, and diminished care quality. The policy is a ticking time bomb that could impact millions of Americans directly. Healthcare organizations are responding strongly. The American Nurses Association, the National League for Nursing, and dozens of other associations have issued statements condemning the move, calling it misguided, disrespectful, and potentially harmful to public health. Academic institutions offering nursing programs are voicing concerns about enrollment impacts, funding, and accreditation challenges. Experts emphasize that this could undermine efforts to improve healthcare outcomes, increase access to care, and ensure a well-trained workforce for the future. The political implications are also significant. Critics argue that this is not just about education classification, but part of a broader pattern of undervaluing professions dominated by women, particularly in a sector where pay has historically lagged behind responsibilities. Nursing is overwhelmingly female, and this policy disproportionately affects women, who make up the majority of the workforce. The move can be interpreted as part of a systemic disregard for essential labor traditionally performed by women, a deeply troubling societal signal. Moreover, it is critical to recognize that nursing education evolves constantly. Nurses are expected to stay updated on medical advancements, new treatment protocols, and emerging technologies. They are not static workers following rote procedures, they are thinkers, problem solvers, and innovators. Reducing their degree classification ignores the evolving nature of their expertise and the increasing complexity of healthcare delivery. It is a short-sighted approach that undermines the quality of future healthcare. Public protests are forming in response. Across the country, nurses are rallying, demanding respect and recognition. College campuses are organizing events highlighting the value of nursing education. Social media campaigns are bringing stories from the front lines directly to the public, showing the reality of what nurses face every day. People are speaking out because they understand that this is not just an administrative policy. It is a threat to the well-being of every American who relies on healthcare services at some point in their life. Even policymakers in opposition have weighed in. Several members of Congress have publicly criticized the plan, emphasizing that nursing is essential and deserves full professional recognition. They argue that any decision to downgrade nursing status should be reconsidered, taking into account the expertise, training, and contributions of nurses nationwide. It is clear that resistance to this plan is building across political, social, and professional lines, and the debate is far from over. The human stories are the most compelling. Nurses saving lives in ERs, traveling long distances to care for patients in rural communities, mentoring the next generation of healthcare professionals. These are stories of dedication, courage, and resilience. Stripping professional recognition from their degrees devalues these stories, diminishes their accomplishments, and risks discouraging future generations from pursuing nursing at all. It is not an abstract issue. It is about real people doing real work that directly affects the lives of millions. And let's not forget research. Advanced nursing degrees contribute significantly to medical research, healthcare policy, and innovation. Nurses with graduate and doctoral degrees conduct studies that improve patient outcomes, reduce medical errors, and guide healthcare delivery on a systemic level. Downgrading the status of nursing degrees threatens the pipeline of researchers and innovators in healthcare, with consequences that could last decades. To summarize the stakes in plain terms, the Trump administration's plan is not just about reclassification. It is a direct challenge to the profession of nursing, the quality of healthcare, and the ethical responsibility we owe to those who care for the sick and vulnerable. Millions of nurses, students, hospitals, and patients are affected. Public outcry is strong, protests are mounting, and experts are sounding the alarm. The message is clear. Nursing is a professional degree, nursing is essential, and any attempt to undermine that is unacceptable. This is a fight that affects everyone, not just nurses. The health of a nation depends on the recognition, support, and protection of its healthcare professionals. When we devalue nurses, we risk every aspect of care, education, research, and public health. Every patient, every hospital, and every community is potentially impacted by this misguided policy. It is a direct assault on those who dedicate their lives to saving others, and it cannot be allowed to stand unchallenged.